and welcome. You're watching the biggest exclusive tonight with me, Griha Dulsuditi. After the easing of COVID-19 restrictions, China is now experiencing a massive surge in coronavirus cases. After first rolling back many of these curbs in early November, authorities on December 7th went much further. As a result, hospitals in China are overwhelmed. Top health experts, though, have warned of worse. They claim that more than 60% of China and 10% of world's population is likely to be infected over the next 90 days with coronavirus, and millions of deaths are also likely to occur. Yes, they are claiming this is going to be thermonuclear bad. Remember how President Xi Jinping's insistence on adhering to the so-called COVID-0 policy isolated China as other countries that suffered far worse outbreaks returned to a semblance of pre-pandemic life? Now that 3 years after the first documented case, the country has significantly loosened its stringent regime, one that undoubtedly saved lives, but also weighed heavily on the economy of China, also fueled protests in several major cities. The abrupt about turn is coming down to biting it bad though. One, for it is during the winter month, and then it has a concerning number of inadequately vaccinated elderly population. Also, China may not even have the healthcare tools to treat a wave of illness expected to kill more than 1 million people through 2023. Now, as per grim reports, one of Beijing's designated crematoria for COVID-19 deaths has been flooded with bodies in recent days. In fact, funerals are taking place 24/7 in Beijing, and still over 2,000 bodies remain backlogged for cremations. Meanwhile, the World Bank has slashed its China growth forecast for the year as the pandemic and weaknesses in the property sector have hit the world's second largest economy hard. Now, let's first talk about why has China's zero COVID policy backfired, what it did do, and how and what it has led to currently. Let's take a look at all of that. Now, what it did do is that every known case, even asymptomatic ones, was mandatorily hospitalized. Now, because of this, a vast majority of population hasn't been infected and has no immunity. So that natural immunity from COVID isn't there. Now, again, even a small outbreak triggered hard lockdowns. So that was how stringent this entire zero COVID policy was. What has led to is that there was a fast spreading variant like Omicron, and they in fact were managing to break through. So that is something that again was detrimental to China. Again, the suspected cases and their contacts were kept under long isolation period, and this is what it led to. The virus was able to spread rapidly after encountering pools of susceptible people. Like I said, no immunity, and hence this was going ahead and happening. Now, let's actually look at where does this zero COVID policy, the watered down version of it, stands when it comes to the country of China. What they are saying now is that home quarantine is now advisable for people with mild or no symptoms at all. Earlier, they were made to be shifted to those stringent COVID camps, which everybody in China dreaded. Now they are advising home quarantine. Snap lockdowns applied to identified areas in case they have identified an area where there could be a possible outbreak. There were small lockdowns. That is what is being advised. Also, schools to remain open. Very, very important point here. This is what they have gone down to. They have decided the schools will not be closed, even if, in fact, there is a campus outbreak. If it's not a wider one, then the schools can go ahead and continue to function. Mass testing has been scrapped. Frontline workers, the mass testing of that also has been scrapped. And they, in fact, frontline workers are to be tested regularly because they come in contact with COVID-19 patients. So that has been a certain Green Health Code Now, on phone now, that is not required. So remember, there was a green health code that China zero COVID policy really stood by. All of that is now no longer required. It's important development there when it comes to the watered down version of this COVID zero. Now, what it has led to is the series of outbreaks that we are seeing. So what we are doing is asking today, this China COVID explosion has a precedent. Xi Jinping clearly lost control of what is happening in China. Let me take this across to my guests who are joining me on the broadcast. Dr. Isaac Bukoch, who is an infectious disease specialist, joining us from the Toronto General Hospital, is with us. Also with us is Dr. Chandrakant Laharia, vaccine public policy and health system expert. And we'd also have Andrew KP Long, who's an international independent China strategy, who's also joining us. We would, of course, be having Dr. Laharia join us in just a bit. But right now, I'll come to you, Dr. Bukoch, first. How bad do you think this is going to be for China? Because what we've seen in the past, China hasn't been able to handle the pandemic when it comes to the healthcare infrastructure that the country really has. So do you think it's ready for another wave of infection?
Well, thank you for having me on, Griha. I really appreciate this. For starters, it's terrible to watch. We've seen some of the footage from China, and obviously we just wish everybody well, but they're in a very tough position. It looks like COVID is starting to rip through many of their communities, and we have to think about some of the hurdles that they have. Very dense urban settings that are perfect for amplifying this virus, coupled with a population that, based on some of the data that we have from China, might not be as vaccinated as they could be, especially in older and more vulnerable cohorts. And then thirdly, it's not entirely clear if the vaccines they used were as effective as some of the other vaccines that are available. So you've got a bit of a perfect storm, unfortunately, with a very transmissible variant in Omicron and a perfect setup for transmission and amplification of the virus in a population that might bear the brunt of more severe infections. And again, we wish well on everyone. We don't want to see anyone sick, especially individuals and communities. But of course, this has the potential to get a lot worse than it is now. And it does appear to be rather bad right now.
All right. Dr. Bukoch, I'll come back to you. In fact, Andrew, let me bring you in here. You have covered China when it comes to the China strategic policies, also the economy for that matter. One thing that has been widely discussed is how has China handled its vaccine policy, many also going on to call it Xi Jinping's vaccine nationalism, where he was insistent on calling the Chinese vaccines much superior than any other vaccine around the world. Do you think that now is hitting China hard, considering there, of course, is ample talk on how they need to actually go ahead and get the Western vaccines in because they are far superior than what China has at the moment?
I think you've got to look at the facts during the past 3 years. China has been exercising a very stringent management strategy, the so-called dynamic zero. But there is a great deal of misunderstanding what this was all about. The idea is not to achieve absolute zero in all circumstances, but to ensure earliest possible detection, earliest possible isolation, earliest possible treatment, and earliest possible cure. And all the while, all the 3 years, past 3 years, China had been quite successful in the eyes of its own people, and according to the latest survey conducted by New York-based Elderman Trust Barometer, EDELMAN, Elderman Trust Barometer, based in New York, and they look at the countries around the world as to people's perception of how they managed the pandemic. China came on top because if you look at the number of deaths, in China, the death rate has been extremely low. The United States has suffered over 1 million deaths, and China's population is 4 times as many.
No, but Mr. Andrew, nobody is denying that fact. I'm really sorry I'm butting in here. But nobody is denying that. However, this entire rollback of the zero COVID norms, and that too, that suddenly is what is being questioned by many of the health experts. And I'm just putting that very point here.
But let me come to what is happening now. The pandemic has now been morphing into an endemic just like in many other countries. And for example, if you go to Europe, if you go to the United States, the government is not even reporting on the number of cases because the infections are very different. I mean, it's just like a very severe case of flu. Now, in the case of China, after 3 years, people's patience is very, very thin. And this comes at a time when the pandemic is moving into an endemic. And that's why President Xi even told personally, openly, to the visiting European Union president, that of course he recognized that people's patience is very thin, but then the pandemic is also changing. So that's why he ordered relaxation. But however, the people have got used to all this stringent management regime, and then they rely on the government, and now they're falling on their own, and people have got to test themselves, and of course there'll be many more reported cases.
Yeah, but I don't understand how you're saying the people have gotten used to it, because we have so many cases that have come out of China where people are talking about the infrastructure, the healthcare, which is really, which is not optimum to actually take care of the kind of outbreak that we are talking about, which is the reason why we are doing this debate today.
I was going to say that the current infections are very different from the infections that happened before, and that these current infections are mostly asymptomatic. In other words, there are not very symptoms. They just test themselves and they found that those have been affected. So people are in a sort of panic mode in this kind of transition, which many countries have already experienced, but China's experiencing it at the moment. And according to experts, this situation is going to last for at least a couple of months. And now the people, of course, have got to rely on ordinary medicine, Chinese medicine, but this has been proven to be very effective. Even my friends in Hong Kong.
But Mr. Long, the experts are also claiming that this might lead to 1 million deaths of over 2023. That is the huge number we're talking about. 60% of the Chinese population, 10% of the world population.
No, I think there's 1 million deaths is an over exaggeration. I mean, the number of deaths so far has been minuscule compared with the United States or even in India.
You're calling it an exaggeration. Let me actually bring in Dr. Chandrakant Leharia, who's a vaccine and public policy and health systems expert, who's also now with us on the broadcast. Dr. Leharia, what you see emerging out of China, what do you make of it? This is the way the Chinese government has handled the situation, this sudden rollback of the COVID-0 policy. Do you think all of that is impacting the situation, what it is now? Or do you agree with Mr. Andrew, who calls it now an endemic situation, which is going to be here for a bit and people will get used to it, and that's how it is going to, go on from here on?
Let's break this into two parts. One, that once China has removed the restrictions, the Omicron variant or SARS-CoV-2 virus is likely to spread, and that's what is happening. The infection rate is definitely high, and more number of people are getting affected. We are also hearing that the number of hospitalization or deaths as of now is low. So the current scenario is of what we know about Omicron variant. Whenever restrictions are removed, there is a high transmission and infection rate. That's what we are hearing. Now, that's part one. But what about the projections? I do not fully know what were the assumptions behind making those projections and those numbers which they are coming up. But what we need to remember about projections, that infection which would happen in late 2022 and early 2023 would have a different clinical outcome than the infection scenario which was there in 2020 or 2021. The reasons are that entire population is not susceptible. Of course, the rate of infection in China is low, but only a fraction of or a proportion of population is susceptible. Second, though, we know the vaccine used in China has a relatively lower efficacy in comparison to other population, but it has definitely more than 50% efficacy, so people have some protection. With this two scenario, even with the high rate of infection and which is going on right now, I do not think that we should assume that it will result in high mortality. But final point I would like to say that considering the country of size of China, 1.4 billion population and 1 per thousand death rate, the absolute number of deaths in China in any case are very high. So we need to know what are those projections talking about, whether which age group of death, whether they're COVID-related death or people with who are in older age and also had COVID. So definitely projections need to be examined in more nuanced way, and do not fully subscribe, and I need to know more about them to comment about those projections.
So, Dr. Leheria, these claims that this is more deadly than the Spanish influenza, never before seen since that happened, all of those claims you're not going by, is that what you're saying? Because here the projected number of deaths is very, very alarming. And at the same time, the kind of stories that we have got from China, from the residents who are suffering. You spoke about a percentage of population. Let's actually talk about that very percentage of elderly population which is not yet been vaccinated or is inadequately vaccinated. By that I mean they do not even have that booster shot that is required of them to have, so that they can deal with this new variant that possibly could go down to becoming an outbreak. Do you think that will be a major problem?
So what we know that in unvaccinated population or people who have no past infection with any variant of SARS-CoV-2, the risk of severe disease and mortality is relatively high.
Okay.
So understandably, considering China has a large population in the elderly age group, there is a risk and there is a probability of a severe adverse outcome because of the factors, no natural infection, lower efficacy of vaccines, etc. So we need to be mindful, but it's really difficult for me to comment about whether those projections are right, how true those projections would be, because we do not know the assumptions behind those projections.
Okay.
But definitely when transmission is going on, the death rate would be relatively higher than the otherwise population.
Okay. So, Dr. Isaac, coming back to you now. So, do you think globally there is still a need to go ahead and look at mitigating what this crisis or projected crisis is going to be, or we can rest easy from what Dr. Leheria has just mentioned?
Well, listen, I mean, like we know from time and time again, if there's an infectious disease issue on one part of the earth, it can impact another part of the earth in as little as 24 hours. These are not local phenomenon, these are global phenomenon. We also have to recognize too that, you know, we don't want to see suffering anywhere on the planet, even if it's on the other side of the planet than our own. And I really, truly wish everyone in China well. Having said that, we've heard a few comments over the last few minutes about, you know, deaths are rare and severe outcomes are rare. Listen, we know what Omicron can do to an under-vaccinated community. We saw what happened when Omicron ripped through Hong Kong last year. They had, at a point in time, the highest mortality rate on the planet. And that was largely because Omicron is not mild, it's milder than Alpha and Delta, but that does not make it mild. And when you do see Omicron tear through a population that's under-vaccinated, especially older cohorts, you do get, sadly, a high number of deaths. Even if deaths are rare, remember, a small percentage of a massive number of people is still a lot of people in the end. And that has the capability to overwhelm healthcare systems. We've seen this happen. We've seen this play out with COVID time and time again in different countries all over the world. Nothing is going to be different in China. And that's why it's so important for people to really, I hope that they are able to get their vaccines out and boost populations, especially older populations that are at greater risk for severe infection, and to really bolster the healthcare system there, because to no one's surprise, there's going to be an influx of people seeking healthcare over the next few months related to COVID and COVID-related conditions.
Okay. Mr. Andrew, talking about vaccination, there was so much said about that Western assistance that possibly is going to be needed by China in this case. There was how earlier we also were told the German Chancellor Olaf Scholz had mentioned the same thing while visiting Beijing. So that was an important discussion that was done. And then again, this entire talk of how impactful is the Chinese vaccine as opposed to the Western, in this case, BioNTech's vaccine that possibly is going to be imported by China in this case. Do you think all of this is going to be the possible future talk in the near future, because we're talking about so many hospitalizations already?
I don't know. I truly don't know what China will do, and I would certainly defer the China policy decisions to my friends and colleagues who are on this call and elsewhere who are experts in China policy. What I can say, though, is that we have seen how COVID can amplify very quickly, and we have seen how it can overwhelm healthcare systems rather quickly as well. And of course, we don't live in a world where COVID is the singular issue. We know that there's other ramifications when a healthcare system is stretched to capacity and beyond capacity, because there's other things that happen, right? People need essential surgeries, people need diagnostic tests, you need preventative medicine and regular routine healthcare, and a lot of that goes by the wayside while all resources are being focused on caring for the sickest of the sick who need support for respiratory illness. So we've seen this happen. We've seen this happen countless times in many countries over the last few years. It's terrible to watch. And truly, I wish China well, and I really hope that they take the steps to ensure that they're vaccinating and they're protecting the citizens and really boosting healthcare capacity. Because, and again, I'm not going to pretend to know all the data that's coming out of China.
Right.
I don't. I do know how COVID spreads through communities.
Mr. Andrew Long take this also. Mr. Andrew Long, do you think that resistance that was there earlier, and President Xi Jinping has really minced no words when it comes to maintaining how the vaccine that is being produced on Chinese soil is the supreme one? Do you think he'll have to backtrack it now that there is an impending visit that is also going to happen of the Secretary of State Antony Blinken? That is later this month. So that is an important visit that is going to take place. Of course, these things will be talked about. Like I mentioned, German Chancellor Olaf Scholz has already mentioned that there needs to be that Western assistance that needs to be given to China when it comes to the BioNTech vaccine.
Well, I think China takes a position that this is a global pandemic. It affects many countries, not just China or India or the United States. And then, of course, there is no perfect vaccine. I think that all countries, China takes a position that all countries should work together. But the facts in China speak for themselves, because China has been relying on its own vaccine. As I said earlier, the international and independent survey conducted by the Elderman Trust Barometer found that the Chinese people do support the government's success, as if I may say so, in containing the pandemic. Because you compare with the number of deaths in other countries, including the United States and Japan, China's death rate has been very, very low. But coming back to the vaccination rate of the elderly, of course, that is a problem. But China is now putting a lot of effort in boosting the vaccination rate of the elderly to something like 90% in a couple of more months. But for the rest of the population, the vaccination rate has been relatively high, approaching 90% already. So it's not just because China is now clamping down on the control. In fact, the vaccination rate is also a very important element in minimizing the number of deaths in China.
So let me bring in Dr. Leheria. Dr. Leheria, let's address the elephant in the room. Do you think China did the right thing by actually watering down the zero COVID policy? And do you think the vaccination drive that the country has is in place? And then in turn, back home here in India, how worried should we be considering the kind of news reportage that's coming out of China?
So what we know definitely that China had a low rate of infection in the past, and that means the natural immunity in the Chinese population is relatively low. That's given. Second, the vaccine-induced immunity we know are always slightly lower quality than, and we do not know how long the vaccine-induced immunity lasts in the population. So that's the second fact. Third, what we know across the world experience in last 3 years, that hybrid immunity is far better than the vaccine-induced immunity alone or natural infection. So putting these three things together, China has a low natural infection, a vaccine-induced immunity. Vaccine were given a while ago. Boosters have not been given to that proportion. And then hybrid immunity relatively less. So China's situation is definitely something where the risk of infection and severe disease is higher. When we compare with other settings, I believe that in today, like 3 years since the start of pandemic, nearly 3 years since the start of pandemic, every country's situation is very different. It cannot be replicated in other settings. For example, in India, at least the rate of natural infection is very high. We had a severe second wave, devastating second wave, Omicron affected wave. And India's adult population has been vaccinated, which has happened after natural infection. So what we know scientifically, hybrid immunity in Indian population is much better and probably lasts longer. We are understanding about it. So it is not immediately a concern, but definitely in this pandemic, whatever is happening in one part of the world can affect other parts of of the world, and there is a risk.
Absolutely. So what we are seeing in China possibly should actually induce us to get our masks back up. At least that's the basic that all of us who are not in China can do, so that we do not have to look at another pandemic that we have just seen, that second wave, the deadly second wave that India witnessed, and of course the rest of the world. I'd like to thank all my guests for joining me on this important broadcast. Now, from one health crisis to another one, a shocking case that has come to fore where a global-scale human organs market is being operated out of Nepal's capital, Kathmandu. CNN News 18 Special Projects team was in Nepal to understand the operational complexities of an international organ syndicate and unravel the mystery of Nepal's illicit kidney trade. My colleague Anvit Srivastav has all the details. Take a look.
Every fourth day, Chudamani travels from Katwaria Sarai in South Delhi to a nursing home in West Delhi to get his dialysis done. He paid an agent 10 lakhs a year back to arrange a kidney for him after selling off a large tract of land he owned in a village in Nepal. With no response from the agent, Chudamani approached another man and paid him 6 lakhs.
क्या दिक्कत है आपको?
अभी किडनी का दोनों किडनी फेल है मेरा।
कब से?
2 साल हो गए।
डॉक्टर क्या बता रहे हैं कि क्या करवाना पड़ेगा?
चेंज ही करना पड़ेगा करा।
दोनों किडनी? चेंज करने के लिए आपने बात किया था किसी से?
बात किया था, पैसा भी दिया था 10 लाख रुपया। वो फॉलोअर निकला, जब पैसा हाथ में आया दूसरे दिन से फोन ही स्विच ऑफ कर दिया।
CNN News 18 Special Projects team was in Nepal to understand the operational complexities of an international organ syndicate and unravel the mystery of Nepal's illicit kidney trade. Many of those who sold their kidneys termed the deal a survival necessity, and they willingly say yes to an organ removal surgery. To them, it's the money that matters.
30,000 आईसी मिलेगा बोला था।
कहाँ पे काम करने के लिए?
वो दिल्ली में।
दिल्ली में?
मेरे को वहाँ पे 3 महीना रख लिया। 3 महीने के बाद तुमको ब्लड टेस्ट करना पड़ेगा, चलो हॉस्पिटल बोला। मैं गया, वो मास्क डाल दिया।
अच्छा।
वो लंबा सांस ले सकते हो तू बोला था। हाँ सकते हूँ, मैं लंबा सांस लिया हूँ। अब मैं मुझको कुछ वो नहीं आता है, वो कुछ
तो मास्क लगाया और बेहोश हो गया।
बेहोश हो गया।
बुखार का इलाज बता के बेहोश किया और ऑपरेशन कर दिया और वापस नेपाल भेज दिया। और ये सारा ऑपरेशन कोलकाता में हुआ था रविन्द्रनाथ टैगोर अस्पताल। तो ये जो लेके गया था और जिसने किडनी निकलवाया, उसने कुछ मुआवजा दिया, कुछ पैसा दिया, क्या दिया उसने फिर बाद में?
6 लाख दिया था।
6 लाख रुपए दिया।
The cost of a kidney has evolved over time too, from employment to hard cash. And for many, the sale turns into a boon during a financial crisis. Here's one such family CNN News 18 spoke to. 3 members have sold 1 kidney every 10 years for the last decade. Anything to make ends meet.
कति पैसा दिन्छु भनेर लगेको?
दिँदा 8 लाख रुपैयाँ दिन्छु भने दिएन।
कति पैसा?
8 लाख।
8 लाख रुपैयाँ नेपाली भाडा दिन्छु भनेको। अनि कहाँ लगेको अनि तपाईँलाई?
दिल्ली।
दिल्ली। अनि तपाईँलाई?
मद्रास।
तपाईँलाई मद्रास। कति पैसा दिन्छु भनेर लगेको?
मलाई त त्यतिखेर त 1 लाख रुपैयाँ दिन्छु भनेर लगेको।
Nepal's kidney racket has taken the dimension of a full-blown human rights issue, forcing corrective measures that officials claim have made some headway.
It has only reached in the urban areas and not to the all people or all poor community. That's why we said that we should not be much reactive, but we should do the preventive works.
The illegal kidney trade that has its roots in Nepal also extensively spans across multiple Indian states. In May this year, Delhi police arrested a doctor from one of the top private hospitals in Delhi, along with 2 of his staff who were involved in a kidney racket. In 2016, 5 persons were arrested for similar involvement, including secretaries to top nephrologists and urologists in Delhi.
The poor and needy people, those who are in need of some money, they are lured into it. We raided one hospital in a place, Gohana in Haryana, wherein such set of hospital was functioning and where the surgeries were being performed.
Human rights commissions are active, and so is the Anti-Human Trafficking Bureau. But what will cut this chain of supplying organs to other countries for money? Will it be a massive crackdown on the markets like India, Bangladesh, China, Western countries and Middle East nations, or only a crackdown on the supply from Nepal? As of now, no one has an answer to it. In this special report for CNN News 18 with video journalist Raju Khatri, this is Anvishir Vastav from Nepal.